Hello everyone, myself Amardeep Kaur, working as a nursing tutor in Khalsa College of Nursing, Amritsar. Today I will discuss about the rights of the patient while administering medicine to the patient. The rights are very important to ensure the safety for the patient as well as for the nurse while giving the drug to the patient. These rights are right client, right method, right drug, right dose, right route, and there are some other rights like right to refusal, right documentation, right assessment, right reason. First of all, we will discuss about the right patient. So, for this purpose, nurse has to read the physician order to make sure for whom the medicine is ordered so that medicine is given to the right patient. Next is read client's name on the client chart as well as on the medicine card for confirm the right patient. Next is call the client by name and ask him to repeat his name, because sometimes there are chances that two patients in the ward have same name, so there is any error. Be careful if the client is deaf or otherwise does not understand your language. So it's nurse responsibility to confirm the name of the patient prior giving to the medicine to the patient. Next is right drug. Read the physician order to study the correct name of the drug. If the order is not clear, so consult the physician or at least senior to prevent from any error. To make sure the drug is copied correctly on the medicine card and on the nurse's record. Be careful of the drugs whose names sound like same, because there are some medicines who sound like same, like heparin, aspirin. Select the right drug from the cupboard and read the label of the medicine container and name of the medicine in medicine card 3 times. Firstly, before taking drug from the shelf. Second, before measuring it. And third, when returning container to the shelf and before removing the hand from the container to ensure the right medicine is given to the patient. Look for the color, odor and consistency of the drug. Before giving medicine to the patient, nurse has to check the color, odor and consistency. If there is any changes in these, so never give medicine to the patient. Next is administer medicine only from a clearly labeled container. If the label is not clear and nurse is unable to read that particular label, so this medicine also not given to the patient. Avoid conversation while giving medicine to the patient, because it always distract the mind of the patient and increase the risk of error in medication. Avoid accepting the verbal orders except in case of emergency, but it should be written on the chart as early as possible. Always identify the clients before giving any medicine and make sure that the drug has not been discontinued by the physician. It is very much important while giving the medicine to the patient, the medicine is continue or discontinue by the physician. Next right is the right dose. So for this, nurse always read the physician order to know the correct dose and always consider the age and weight of the client, because there are some medicines prior given to the medicine to the patient. We have to assess the age and weight of the person before giving the medicine. Nurse also have the knowledge about the minimum and maximum dose of the medicine whenever measuring the medicine. So measure it accurately, and for accuracy use ounce glass instead of teaspoon. Have medicine card or written order in hand before prepare the drug, because nurse cannot given any medicine or any drug without any prescription. Know the abbreviations and symbols used for the dose. For example, mg, that is milligram, ml, that is milliliter. So nurse should have the knowledge regarding these abbreviations and symbols. Make sure the medicine glass is dry before pouring the medicine. Hold the ounce glass at eye level while measuring it for proper or accurate measurement. Next, fourth right is the right time Read the physician orders. Next, nurse should have know the hospital routines and know the abbreviations for the time. For example, BD, OD, TDS. Nurse should have the knowledge regarding these abbreviations. Like if any drug is written along with BD, so BD means 2 times a day, OD means 1 time a day, and TDS means 3 times a day. The medicine which is given TDS, so it means the medicine is given 3 times a day. Give the medicine near the time ordered, 15 minutes before or after the designated time. Give the medicine as ordered in relation to food intake, for example, before food or after food. Sometimes some medicines are taken before taking food, or some medicines are given to the patient after food. Next is the right method. So for right method, nurse has to read the physician order to determine the route of the administration. Next, dilute the medicine if indicated. There are some medicines which are in powder form, so firstly nurse has to dilute that medicine and then given to the patient. Know the method of giving drugs, that is orally, parenterally, that is through the injection, rectally, that is through the rectum injection. So whenever give any medicine through the injection, so nurse should have the knowledge regarding the abbreviations, that is IV, intravenous, IM, intramuscular, and also have the knowledge regarding the methods, that how IV medicine is given to the patient, IM injection is given to the patient. Next is identify the client correctly, know the abbreviations, and stay with the client until he or she has taken the medicine, because sometimes the psychiatric patients, especially the psychiatric patients, they can never they can take the medicine in mouth, and then when nurse just given the medicine, so they just spill that particular medicine. And also never leave any medicine with the client, especially in the psychiatric client, never leave any medicine. And whenever there is any medicine error by the nurse, so it's her responsibility that it should be reported immediately to the senior or the physician. So this is all about the rights of the patient while giving medicine. Thank you.